Dominick Frosh. I'm an associate investigator at the Palo Alto Medical Foundation Research Institute and also associate professor of medicine at UCLA. And my presentation today was about the role of relational coordination in implementing patient decision support in primary care.
Thank you for your presentation today, Dominick. Can you describe or summarize your work in relational coordination that led to your presentation today?
Yes, so for the last 3 years, we've been working in primary care practices to implement decision support for patients. And we really had never thought about relational coordination when we started that project, but one of the things that we observed over time is that among the 5 departments that we were working with, there was considerable variability in how they performed. And so one of the things we thought about in trying to understand this is what is the role of relational coordination? And we were very fortunate that a colleague of ours, completely unrelated to our project, had conducted a survey of relational coordination throughout the healthcare delivery organization that these clinics are part of. So this gave us an opportunity to look at the role of relational coordination and trying to see how it associated with the performance that we observed in these clinics in terms of providing decision support to patients. And very interesting for us is that the highest performing clinic also had the highest relational coordination scores, and in turn the lowest performing clinic had the lowest relational coordination scores.
Dominick, what were the key takeaways from your RC work that you presented here today?
I think the key takeaway is that relational coordination clearly matters, and it impacts the performance for organizations that are trying to bring about a new way of doing things. So I think one thing that we can certainly say about healthcare is that, and this is certainly true for other spheres of life as well, but nothing is as constant as change. And so it's with it constantly happening, I think one of the takeaways is that if we can have better relational coordination in a department, then those departments will do better in allowing change to occur. And being that that's a constant, that is something that certainly would be very valuable for any organization.
Dominick, as the roundtable topic today focuses on working together, building knowledge, and advancing research and best practice, what were the lessons learned that you captured in the RCRC roundtable dialogues, discussions, and reflections?
I think the key thing that I'm taking away is that, again, when we started this project, we didn't even know about relational coordination. We'd never heard of it. And we've certainly, along the way, puzzled about, well, we're seeing these changes, what can we do about it? And what I take away from all of this now and from the discussion that we had at our roundtable is that we need to start thinking about relational coordination as something that can help us think about how do we intervene to create more effective communication structures in departments that will not only affect a particular change that I might be wanting to be working on, but can actually have a more positive effect more broadly in that it makes any kind of change easier to accomplish when teams are more effective, have shared goals, shared knowledge, and mutual respect.
Dominick, finally, what are your next steps as you develop relational coordination in your institution and with your clients?
So our next steps really would be to move along that path and think about how we can not only bring about a particular change that we think is important for improving healthcare, but thinking more broadly and more generally about how can we improve relational coordination irrespective of a particular project in a department, because that will make things more effective and will lead to higher performing departments.
Dominick, thank you for presenting today.
Sure, it's my pleasure.